Um, Thank you. We are here as a follow-up meeting of a meeting that we held last week on Wednesday. And during that meeting, we agreed that we were going to have a multi-stakeholders meeting or a multi-agency meeting. In this meeting, we have representation from the Ministry of Education, the Ministry of Health, we have ODPP, we have GAO, that is National Government Administration Officers. We have the Ministry of Gender, Culture and Children's Services represented. We have Judiciary, we have NGOs, we have CBOs, we have the police, yes, we have DCI, we have all those people who are actors in the space. Reason being, in the recent past, the central region has been bleeding. There are so many social problems that we're handling. And today we were looking at issues ranging from gender-based violence, including femicide, defilement of our children. Our children in the recent past have been abducted, defiled, and brutally murdered. We've been having cases of suicide. These cases are on the rise. We're told that we have more than 680 cases from last year June, up to now, spread all over the entire region. We have FGM, that is female genital mutilation, which is creeping back slowly. We thought this was a problem of the past, but it is creeping back again. So that is why we have this meeting. We also have issues of mental health, and that is why it is a multi-agency meeting. Because we believe no single agency can deal with these issues on its own, we must work together collectively, because it's only that way that we are going to make a difference. Now, we have come up with various commitments. Each and every county has come up with some commitments, and we have agreed that within 90 days we are going to have another line, and we are going to hit the road running and make a difference within the 90 days. There are those short-term commitments that we can achieve within the 90 days, and there are those that are long-term. But what we have agreed together is that within 1 year, this is going to be a region of excellence. Others are going to benchmark with us. It's important to note that this is an initiative that you are going to duplicate in all the other regions, because what is happening here is not an isolated problem, or these problems are not isolated. It is happening all over the country. But apparently, the central region has been experiencing escalating cases, and that is why we started with this region. So as we proceed, we are going to even do better, we are going to excel, and these cases are going to be cases of the past. We are going to have religious leaders as well. Now, after this, the same commitments that we have made here will be cascaded all the way to the grassroots. And that way we are going to deal with these issues once and for all. You might be asking yourselves, which are some of these commitments? One is that we are going to close down all those bars that are serving illicit brews, those that are operating within hours that are not allowable, or admitting children, and those ones that are not following the laid down laws and regulations. We have also agreed that the Ministry of Education will ensure that our children are going to school within the hours that are stipulated, because we have had cases of our children going very early in the morning when it is very dark, or leaving school when it is very late. We have also agreed that we are going to patrol, first and foremost, map out the hotspot areas and then patrol them, and then arrest all the perpetrators, the ones that are known, and then share data If you have FGM cutters that are known, because they are there, we know, this is a society, we know each other, they are also going to be arrested. So we have agreed on such commitments among many others, and I want to assure this nation that there is going to be a difference. His Excellency the President has given us a job, and it has to be done. He has always insisted that people must live in an area or in a society that is free, that is safe, and where people can be treated with respect and dignity. Our children are being defiled by left and center. These are our children, they are our future. We are destroying our own future, and that is why these cases must be dealt with once and for all. Thank you.
So, Madam PS, Madam, just one more question. In your own, as a committee, what is really fueling this increase, or the increase of these cases, especially in Central Region?
Many reasons have been identified, and apparently all these reasons are interrelated. It's interesting. Alcoholism has been identified as one of the reasons. Abuse of drugs and substance has been identified. Economic reasons have been identified, or mental issues have been identified. But you'll see a situation whereby one is emanating from the other. You know, one is not doing well economically, so resorts into first and foremost goes into a depression, then goes into alcoholism, then goes into GBV. Okay, so all these problems are so interrelated, and that is why we can only deal with them as we can only deal with them collectively as a multi-agency.
Another question, when you talk of 680 suicide,
the gender that is mainly affected is the men. I would say 75% of the cases are men, while the rest, I would say 25 are women. The age group is mainly
the 50s, 40s, 40 to 55.
It's interesting that 40 to above 40, but we also have some cases of young people. Just the other day we buried quite a number of young people, but mainly the elderly. I think they're getting frustrated, especially those ones who are alone, and eventually they are taking away their lives. Thank you.